So Cameron, your numbing cream has now been on for a little while. It should be ready to come off. Are you ready if we get started on the next part of the process? Okay.
A lot of people don't know that just as 1 in 5 adults in Canada have chronic pain, 1 in 5 children have chronic pain as well. And then when they come to the hospital, we almost always do something painful, or they come in with a painful condition. So it's a big part of their childhood. ChildKind International is an organization that certifies hospitals as being pain and distress friendly. We are now a part of a group of institutions that is recognized globally as being leaders in children's pain care.
This is about helping kids manage pain, have positive experiences with healthcare. Of course, kids are going to go through difficult things here in the hospital, but how can we help make it as easy as possible? And so we do that in a lot of different ways. We can use pharmacological methods, so medicine, whether that's numbing cream or pain medications if appropriate. But we also use physical and psychological strategies as well. So things like comfort positioning, rather than pinning kids down, holding them in a big comforting hug can really help that experience be more positive.
Cameron lives with chronic pain. You could see that he was in pain, and it definitely affected his mental health. This last surgery that he had, the doctors and the nurses, it was the first thing on their mind every time they walked into that door. It was, how are you feeling? Is there anything we can do to make you more comfortable? It wasn't always just about pain medication, but it was all about pain management. And that was, I think for us, was like the biggest thing.
When I was in pain, like I'd kind of have an angry mood, and more like I would ignore my family and everything. And now that I have like less pain, I'm in a more cheerful mood.
Children's pain matters. So whatever we can do to lessen that distress will help them be better, well-adjusted adults.